this is Dr. Thomas from Tips of a Psychiatrist, and today we're going to be talking about bending our perception, which is really this concept of just because things the way they are doesn't mean it's actually what is happening. And here's an example. Say you're struggling with anxiety, which we all do, by the way. It's inherent. Anxiety is just like one of our fingers. It's tied to our hand. It's part of us. It's part of everyone. It's just not the fact that you have anxiety, which I know may be a disorder. And by the way, get professional help. But it's inherently a part of all of us. So this is very relevant. So in terms of dealing with anxiety, notice when we're sick. And right now it's wintertime, flu season's coming in. And I ask all my patients at this point, and I say, what did you notice? I bet you weren't anxious during your sickness. And they say, no, I wasn't. And that's right, because the body itself is basically using all of its force, all of its resources to cure the sickness itself. And because they just were sick, they can still remember the feeling. And this is the key, is I bring out the feeling that they can actually relate to. And they can actually understand that their mind went blank to anxiety. And I encourage them and I say, this is the first clue. It's the first clue because the perception of oneself, if you're anxious, is all you are anxious. And actually, no, you are anxious, but it's within this bigger personality, this bigger capability of yourself. And if you see yourself as, yes, I'm anxious, but I'm also not anxious, you then can break actually the feeling, the ties to such a concrete and a belief in yourself, which actually is wrong. It's wrong. And this is called CBT. This is our left hand. I call it my left hand because we know our hands very well. We use them without thinking. And CBT, say, would be the left hand. DBT, by the way, is the right, and there's other things that we can do. But for CBT, we challenge. We challenge these beliefs because we find that very depressed people, and this is stemming from Beck's observations, who, by the way, was a psychiatrist, and was amazing is both Beck and Freud had their daughters who were also psychiatrists, and it was actually their daughters who applied the theory to real patients, got real outcomes, by the way, improvement. And if it wasn't for their daughters, they would have never been basically in the halls of fame for psychiatry. Freud, of course, we all heard. Beck, you may not have heard, but you've certainly heard of CBT, cognitive behavioral therapy, or really it's thought therapy. And we challenge these thoughts. This is our left hand. So what we're doing right now is we're challenging the belief that someone say, all I am is anxious, or no, of course not. Of course I can't go to bed at this time. It's just too anxious for them to actually admit to. They can't do it. Or, I hear a lot of examples. This is really a wild one. Say if you're ordering something to eat, and I once was told this story from someone who's anxious, who heard this from someone else who wasn't a patient, and they said, oh my God, my Uber Eats delivery is coming at 6. What am I going to do? I eat at 5. And you can see how this is romanticizing the disorder. It's basically going all in on your belief to the point that you believe in it so much that you start to defend it. And it's really exciting to get to this point because you can start to understand perhaps how we can break this relationship of the mind to a belief. Because get this, remember the example that we went back to in terms of the sickness and understanding that there was no feeling of anxiety when one is in bed with the flu, fighting fever, cough, phlegm, the whole shebang, could be diarrhea, vomit, the whole deal. But yet, if you ask sometimes someone who's super, super anxious, they will not admit to the fact that they were not anxious. Those that may be getting better, that may have more relationship with, or I challenge back, may in fact say yes, finally. But the gut reaction for someone who's anxious is not to admit to not having anxiety. I know I'm using double negatives here, but they do not like to admit that they're not anxious because their whole belief base is that they're anxious and their life they structure around it. is around anxiety. Their sleep patterns are off, which makes them more anxious. If they take a medication for sleep, it makes them feel fuzzy and I'm just so tired the next morning. Well, guess what? Getting more sleep produces relaxation chemicals. That's why when we have a really deep slumber, we wake up and we're like, oh, I'm just like trying to get accustomed to the day again. And that can be the benefit of sleep medications. So it's a slow unwinding that we have towards this perception of ourself, that we seem to put our line in the sand, this flag that we want to stick and support. But you know what? It cannot hold much weight once we start to question it, once we start to challenge it, once we start to use these principles of CBT in our left hand. And not to like fall back on some like great magical therapy. It's not these magical words that everyone uses, but it's using these principles in exciting, dynamic ways. And it's just very interesting when we hear patient after patient, case after case, and we pick up now as a psychiatrist, you see it's as if I'm leaning, with my ear to listen. We start to be the stethoscope. We have no instruments in psychiatry. We have no instruments in therapy, but yet we are the instrument. And it only becomes finer tuned when we hear patient case after patient case, and we pick up, say, an interesting nuance. Let me bring this to myself. I was lucky enough to get to the Mediterranean this summer. It was only for 2 days, so we had points. It was really great. Stayed at a resort, had the open sea, the pool, that idyllic picture in your mind of the blue, the calm, and the Mediterranean is so calm. And when I arrived, I didn't get it. Everyone else got it at the resort. I didn't get it. I felt like I had to do something. I'm not a real big person that always looks at my phone, but of course I had to pick it up because I didn't know what else to do other than relax. And I eventually looked around the pool and said, wow, everyone's relaxing except me. I'm the one who doesn't look like everyone else. And from that point on, I then joined the people that were relaxing by the pool or those that were swimming in the sea and enjoying themselves and basically coming to the state of relaxation. And what I realized, again, we're all challenged by our anxiety in life. This is just not for those with the disorder itself that affects their life. But I was realizing that I was living with anxiety that was here on me during the day. A lot of family pressures say that we have children that we need to educate and pay for, and relationships that we need to maintain. And we may have sick family members. We may have care provisions for pets. We have work stresses. We have the everyday stress of, waking up, being functional, trying to be people to both those who we serve professionally and also in our personal lives. And so all these stresses were living with me. I like to say, like, as if they were right here in front of my nose, like as if there's a wall of anxiety right here, right now. And after that trip, I said to myself, I'm going to put the anxiety in the next room. So now my anxiety lives in the kitchen. That's where it lives. Now, of course, sometimes I go to the kitchen, of course. The fact is that because it's in another room and not with me here, I've changed my perception. And I really feel that we are now working with a concept of perception. And I believe that the perception that we have, either we radically hold on to things that aren't true, or can we actually use our right hand? Oop, I did use it today. I often do. This is DBT, D like dog, means dialectical, the opposite force. Can we use the opposite force here and basically understand that I have become able in one, quick reality check. Of course, it took me to get to Europe and look at the Mediterranean and see how I was different. But the reality check is real. And my real use of that, and that's why I ask everyone, it's time to put it into motion, put the plan into motion. And instead of the small step that I thought I could take towards helping myself, I actually took a much bigger step because now the anxiety lives in the room next door. So what I want to do is teach you through both how just this first use case that I've seen in patients where when they're sick, they free themselves of anxiety. And we can certainly relate to COVID for those who had it, or a major flu. And that's the clue. You don't have to be anxious. You can choose to be anxious. You can be selectively anxious. You can be working with anxiety. And I believe that is the first stone, so to speak, that we throw against this wall of false belief. And we start cracking that wall of false belief. And I've given you a real life example for myself. I encourage you to get professional help. I encourage you to get therapy. I encourage you to work with a psychiatrist. In my case, I do both. And you can see why I'm very excited about therapy every day. I'm very excited about making these relationships that do therapy. So I do them combined. And that's really where my belief base, and there's very high evidence in both medications and therapy, and then all the therapeutic techniques and tools come in together. So I encourage you to start challenging your own perception, to get professional help, and I'll leave you with that. Perception is the goal. I'm Dr. Thomas. This is Tips from a Psychiatrist. Thank you for watching.